Ketamine can be used in a variety of different dosage ranges and routes of administration. And one way of using ketamine is microdosing ketamine. And ketamine microdosing is, in my opinion, a very promising treatment protocol that is hugely underutilized, and it can really fill a gap in care for a lot of people. When we compare ketamine microdosing to, say, daily antidepressant use, for example, what we see with daily antidepressant use is, and this is not to knock other pharmaceutical methods because they have their place, but if someone's using an antidepressant on a daily basis, it's really quite a production when they decide they want to stop in terms of tapering them off, dealing with withdrawal symptoms, et cetera, et cetera. And ketamine microdosing is much more forgivable in terms of when it comes time to stop or when it comes time to take a pause. We don't see people going into these withdrawal crises in quite the same way. And we have a lot of options in terms of the dose ranges. So it's very easy to customize it to the client, not just in how much they're doing and how often, but also the routes of administration. So we can really, really tailor it to the client's needs. Another lovely thing about ketamine at every dose range is it plays really well with other medications. So if someone is using another psychiatric medication for depression or anxiety management, ketamine can often be used in addition to those other medications, instead of them, or in the tapering process. And the same is even true if someone is addicted to fentanyl and they want to switch to, say, buprenorphine or Suboxone is the brand name. Ketamine can also be used to help ease that transition as well. So it can be used just as a bridge to support a transition, or it can also be used long-term. If you did like a troche that has, let's say, 16 milligrams, I think the lowest I've gone with people is 4. So you could do a troche with 16 milligrams and just take a fourth to get 4 milligrams. That's a pretty standard starting dose for people. And you can always bump it up from there. You can always take more. You can't take less. You can't take 16 and go, oops, I wish I'd taken 8. It's like, well, then you're stuck with it. So you can always take more if it's not enough. On the first time you take it, you don't want to plan, I'm going to start this new medication today and then drive, a car. No. You want to give yourself a few days, find that right dose. And once you're in that dose range where you're very clearly functional, probably okay. Now, the thing with microdosing ketamine is we don't have studies on this. So we don't know, for example, you take a microdose of ketamine, you feel perfectly fine. Are your reflexes as fast? Are your response times as fast? We don't know. That's the full disclosure. I will say, I know many people who microdose ketamine and function absolutely normally, drive a car, do all the things they normally do, and all they report is that they feel less anxious and that their mood is better. And that's if that's the right dose, which is why, you always want to do the lowest effective dose for each person. I do have a couple of patients that have been on it for years. All of the patients that have been on it for years have a significant physical injury with chronic pain and a mood issue that arose in light of the injury. So typically post-traumatic stress disorder. So I'm thinking one of my patients, for example, experienced a significant injury that was a traumatic event. He now has PTSD and chronic pain. So he takes a microdose of ketamine, actually not every day anymore. We've gotten him to a place where he doesn't use it daily, but he uses it regularly, and I want to say been about 3-4 years now. Now, that's kind of a severe case. For others, it really depends on what you're using it for. If you're using it for mood support and you're pairing it with therapy, less than a year in most cases. If it's because you're going through a really hard time in life, let's say going through a divorce and legal battles, really, really stressful period of time, just to get through that stressful period of time. And then you're done. So that could just be a couple months, could be 6 months, could be a year. And as I said earlier, unlike other medications that you might use to get you through a hard time, Ketamine's a lot easier to discontinue when you feel like you don't need it anymore. You can also skip days. You can also skip doses. Assuming you haven't developed addiction, which most people don't, but that risk is there. It's very forgiving when it's time to say, thank you, you got me through this period and I don't need you anymore, to the ketamine. It's pretty easy, relatively, to stop. So I have other patients who they don't take their ketamine microdoses regularly, but they've just got a small supply at home for situations that they know are going to trigger their traumas. So flying, for example, or I have a patient who was when she lived in a particular city and she has to go back to that city for business trips sometimes. So when she's back in that city, a lot of her trauma triggering comes up. She takes the ketamine with her on those business trips. Then the rest of the year, when she's at home and not in the place that reminds her of the trauma, she doesn't need it, right? So this is the beautiful versatility of this molecule. You really don't have to be so stepwise with it as you do with an SSRI. You can just stop it like that. Yeah, most people can. If there is trouble doing that, then it can absolutely be done in a stepwise fashion to go down. But we don't see those horrific withdrawals like we do with a lot of other psychiatric medications. Like for SSRIs, you got to go slow and gradually decrease the dose. Benzodiazepines, those drugs like Xanax, Ativan. If you're using them daily and you stop abruptly, that withdrawal is not only horrible, it's also dangerous. It can be life-threatening. And we don't have that with ketamine. So you're not significantly putting yourself in jeopardy if you stop at cold turkey, especially if we're talking about doing it in a microdose range. Most people can just stop, and people forget their doses and they don't have those withdrawal headaches or the brain zaps or the other untoward effects you see with a lot of other drugs. Low doses of ketamine also improve brain plasticity and BDNP, which helps the brain learn and unlearn. So you're also actually increasing neurogenesis in the brain. You're helping the brain grow new neurons and connections. So ketamine can help in that standpoint. What happens with long-term use of an SSRI is the brain actually adapts to the drug by down-regulating serotonin receptor sensitivity and number. So you don't have as many serotonin receptors in your nervous system if you are a long-term SSRI user. So far as I know, ketamine is not going to help those receptors come back faster. It could, but I don't have data. I haven't seen data suggesting it does. And that's where, the slow and steady process is just going to continue to help somebody. But the ketamine can keep that person more emotionally stable and more comfortable through that tapering process. So it can help emotionally and with brain plasticity while you're waiting for those serotonin receptors to sort of come back online with the tapering protocol. Ketamine is more than placebo because we know that it actually can have an anti-inflammatory effect in the nervous system and it can support neuroplasticity. So it's your placebo that's also increasing neuroplasticity, which is not bad, not too shabby. How long the neuroplasticity effect lasts, I don't know, to be honest with you. We're on the cutting edge here with a lot of this. And when we keep in mind that when people are microdosing ketamine, they're often doing it on a regular basis, daily or at least several times a week. That's a pretty significant, it's a low dose, but it's frequent nudge in that direction. And that really comes through in people's cognitive ability. So if someone's microdosing ketamine and they feel like they can't focus as well, or they feel kind of dumb or slow, or like their memory's not as good, the dose is too high. So often what we see in individuals who are microdosing ketamine is they feel like their brain works better. And that very well could be because of the neuroplasticity effect. And it can be used for more than depression, but I'm just going to harp on depression because so many people have it. A huge ailment that comes with depression is that brain fog of when people are really in a depressed state, they have a hard time focusing, they have a hard time engaging, they might feel stupid, or they might feel like not as sharp as they know that they can be. And so with that ketamine microdose, you really get the dual benefit of the mood support and the cognitive support. Because a lot of the things that make us feel less crummy emotionally make us a little stupid also, or slower. Considering the neuroplasticity effect of the ketamine, also the fact that yes, ketamine is a dissociative drug, but with the microdose, you're not taking it at so high of a dose that you're checking out emotionally. The dissociative effect more is like you can talk about the things that are hard without them upsetting you quite as much. And so this all makes ketamine a very, very powerful adjuvant to therapy. So a lot of people who have mood issues and have tried therapy and just felt like it was a waste of time, or they couldn't get anywhere, or even that therapy made them worse, if you pair the therapy with microdose, it's like four-wheel drive. You can get so much more out of therapy, and the therapy can help you get so much more out of the ketamine. They really go together very, very, very beautifully. And when we talk about how long you need to be taking it for, if you're microdosing ketamine and doing some kind of therapy, whether it's talk therapy, somatic therapy, or even just going to an ecstatic dance twice a week, doesn't matter, you're not going to need to be on the ketamine microdose as long. You're going to get better faster. Or even people who want to try microdosing, but what happens if you take a microdose and it does make your anxiety worse, for example? Wouldn't it be nice to do that in a setting where there are caring people who are familiar with the substance who can support you through that experience, and make it less scary, just kind of lower that bar. So concerns with microdosing of ketamine is, as covered in other places, ketamine can be addictive. So if you have a client who's working with microdosing of ketamine, or you yourself are microdosing, you really just want to keep an eye on that. Is there craving for it? Is there compulsion around the use? Just keeping an eye on that potential for addiction. That being said, if we're sticking to the microdose range, particularly in somebody who does not have a propensity for getting addicted to substances, we don't typically see issues with it, but we absolutely have to be cognizant of that risk. There's also that risk of bladder problems. In my opinion, I think that risk is overstated. Most of the issues that people have with bladder problems, it's with recreational ketamine that has adulterants and other substances that are not ketamine mixed in. Or in people who have an underlying bladder condition, like someone with interstitial cystitis, for example, probably shouldn't be microdosing ketamine. We also have special consideration in people with diabetes, that ketamine can actually increase blood sugar levels in those with diabetes, which doesn't mean it's a hard no. It just means you really want the sugars under control. And when starting with the ketamine, monitoring the sugars to see if you need to go up on any of your other medications that manage the blood sugar. And of course, as starting any medication, until you get the dose quite right, you want to be careful. With ketamine in particular, you don't want to be driving a car, operating heavy machinery. If you've got young kids at home and you're starting a ketamine microdose, wait until there's another adult there. Wait for a day when there's someone else there to care for the kids or the dependents. Because if the dose is too high, you're going to get drowsy. If the dose is way too high, you'll start getting the depersonalization or you'll start hallucinating. That usually doesn't happen when we're playing with microdoses because the range is so low. But, if you're feeling sedated and you got to go pick up the kids from school, that's not a good situation. So you really want to get your dose dialed in first and foremost before you kind of go back to business as usual. Now, in terms of the dose ranges, the beauty of microdosing ketamine is that you can really play with the dosage. I have some clients who are on as low as just 5 milligrams of ketamine a day. I have some that are pushing the dose range up to 100 milligrams a day. Now, the clients that are taking 100 milligrams a day, if we're calling it a microdose, they're not taking the 100 milligrams all at once. They're taking maybe 10 milligrams at a time for a maximum of 10 times a day. And so when we're talking about low dose ketamine or microdose, and what's the difference? It depends on the patient, right? But I put the cap at 100 milligrams a day. Once we're doing more than that, we really should be thinking about like, okay, we shouldn't be calling this a microdose, and we should be taking some other things into consideration. But considering that ketamine has a relatively short half-life, especially if we're using needle-free routes of administration, it can be dosed more than once over the course of the day. And so rather than taking a big dose that zonks somebody out and leaves them on the couch for the whole afternoon, they might take a small dose in the morning to help get them through some stressful meetings at work, and then a small dose when they get home from work to help them get through that sort of after school stress with the kids, and then maybe another small dose before bed to help them get to sleep. So you've really got flexibility on how much you take and how frequently because of that short half-life.